How do court and MRI diagnose ischemic stroke? Have you ever wondered how doctors quickly diagnose an ischemic stroke? The answer lies in advanced imaging techniques like computed tomography and magnetic resonance imaging. Both methods are crucial for identifying strokes and guiding treatment. Let's break down how each of these technologies works. Computed tomography, or CORT, is often the first imaging test done in emergency situations. It is favored because it is fast and widely available. A non-contrast CORT scan is primarily used to rule out hemorrhagic stroke, which is bleeding in the brain. This step is vital because if there is bleeding, certain treatments for ischemic stroke, like thrombolytic therapy, cannot be given. In the early stages of an ischemic stroke, changes on a CORT scan can be subtle. Less than half of the cases show clear signs right away. Some early indicators include a loss of the normal differentiation between gray and white matter, swelling of brain structures, and areas that appear darker due to cytotoxic edema. These changes can signal irreversible damage to brain tissue. To enhance the CORT diagnosis, doctors may use CORT angiography and CORT perfusion. CORT angiography visualizes blood vessels to identify blockages, while CORT perfusion assesses blood flow in the brain. This helps determine which areas of the brain are at risk and which have already been damaged. These advanced techniques are particularly useful for deciding on interventions like thrombolysis or mechanical thrombectomy. On the other hand, magnetic resonance imaging, or MRI, provides a more detailed view of the brain. Although it takes longer and is not always available in emergency settings, MRI is more sensitive and specific for detecting early ischemic changes. The diffusion-weighted imaging sequence is particularly effective at spotting acute ischemia by showing areas where water movement is restricted. Fluid-attenuated inversion recovery imaging is another MRI technique that helps distinguish between different stages of stroke. It can reveal subtle changes in brain tissue that might not be visible on a CORT scan. Additionally, gradient-recalled echo and susceptibility-weighted imaging can identify any bleeding or blood clots present. Perfusion-weighted imaging complements diffusion-weighted imaging by evaluating blood flow in the brain. This helps differentiate between the ischemic core, which is irreversibly damaged, and the ischemic penumbra, which may still be salvageable. Some stroke centers are now considering MRI as the first imaging choice due to its advantages, even though CORT remains the standard in many emergency situations. Each imaging method has its strengths, and the choice often depends on the specific clinical context, availability, and urgency of the situation. In summary, both CORT and MRI play essential roles in diagnosing ischemic stroke. CORT is the go-to for quick assessments and ruling out hemorrhage, while MRI offers superior sensitivity for early detection and detailed analysis. Together, these imaging techniques provide a comprehensive evaluation of acute ischemic stroke, ensuring timely and effective treatment. Always consult with healthcare professionals for personalized medical advice and information.